Millions of Americans could enjoy a better quality of life and have better health with dental implants. Did you know 35% of those over 55 years of age are missing their entire upper or lower teeth? 15% of those aged 40 to 44 and 26% of those aged 65 to 74 are missing all of their teeth. Regular or traditional implants have been used by dentists for decades to restore patients' mouths. These implants have been generally 3.5 millimeters to 6 millimeters in diameter. Up until just the last few years, if your bone wasn't thick enough or substantial enough for this size of an implant, your only choice was to have bone grafting. With Mini-Implants, which are 1.8 millimeters to 2.5 millimeters in diameter, we can place implants in areas of much narrower bone. If you've been told in the past that you're not a candidate for implants because of bone loss, you may be a candidate for Mini-Implants. Yes, absolutely. Your situation is very common. We see many patients who have a full set of dentures and their uppers are fine, but their lowers dig into their gums. The full lower denture can be very uncomfortable because during chewing, the lower denture moves around a lot more than an upper denture. Dental implants can almost always be placed to correct the floating lower denture, even when there's extensive bone loss. We can take a CAT scan that we have right here in our office and tell you what we can do to correct the problem you are having. More and more patients are becoming interested in mini-implants because they have a series of advantages when compared to the traditional implant. We recommend mini-implants for patients that don't have enough space or bone density for a traditional implant, as well as for older patients that want a quick and efficient solution to repair their denture. The procedure is minimally invasive, and the patient can actually use the mini-implant in the following days. To choose between an implant or a mini-implant is not something you can do by yourself, as there are many factors involved. This is why we offer a free consultation, so you have the opportunity to get your questions answered and find out what is best for you. Many patients complain about having to add adhesives to secure their dentures, especially after drinking a cup of coffee or eating. This is really a nuisance when eating at a restaurant and having to excuse yourself to go to the restroom because you have food under your dentures. There are 30 million people in the United States with no teeth, and 35% of those people chew only soft foods. Laughing, sneezing, and coughing can also cause trouble for people who depend upon adhesives to hold their teeth in place. Many use denture adhesives to hold their teeth in place, but are weary of the constant bad taste, odor, and mess. With mini-implants, there is no need for adhesives. Some patients are never able to adapt to functioning day to day with their complete dentures. Many of these patients do not have adequate bone to stabilize a lower denture. Others never develop enough muscle coordination to learn to chew with their dentures. For many years, dentistry had nothing more to offer these patients than a denture adhesive. Today, such problems can often be managed through the use of implant dentistry. Even with as few as 2 dental implants, the retention and stability of a lower denture can be greatly increased with an implant-supported denture. In fact, the chewing efficiency can also be greatly increased. Patients regain up to 75% of their original chewing capacity with an implant-supported denture. Overall, patients feel more confident with a dental implant when they're in public because they no longer fear that their dentures will slip or cause them embarrassment. Nope, you would not need an implant for every tooth that is being replaced. The number of implants necessary would depend upon the type of teeth that you choose to fix your problem. We frequently place 2, 3, or 4 implants to support a lower denture and stabilize it. We also place 4 to 6 implants for a permanent solution, like an all-on 4, to allow a prosthesis to be permanently screwed to the implants. There are many choices to consider.